Welcome to the world of medical nanotechnology. In this script, we will explore the fascinating field of medical nanotechnology and its applications in breast cancer treatment and diagnostics. By the end of this script, you will have a comprehensive understanding of targeted nanotherapies, stimuli-responsive drug delivery, multifunctional nanocarriers, thermotherapy and hyperthermia with nanoparticles, photothermal therapy using plasmonic nanoparticles, magnetic resonance imaging, MRI, contrast agents, nanosensors for early breast cancer detection, microfluidic devices for liquid biopsies, nanobiosensors for circulating tumor cells, CTCs, nanoparticle enhanced radiotherapy, nanoparticles for gene therapy in breast cancer, and 3D bioprinting of breast cancer tissue models. Let's dive into our first topic, targeted nanotherapies. Nanotherapies involve the use of nanoparticles to deliver therapeutics directly to the target site, minimizing damage to healthy tissues. In the case of breast cancer, targeted nanotherapies aim to deliver chemotherapeutic drugs specifically to cancer cells in the breast tissue. These nanoparticles can be engineered to have specific properties, such as surface modifications that allow them to recognize and bind to cancer cells. Additionally, they can be loaded with anti-cancer drugs that are released in a controlled manner once they reach the target site. This approach improves drug efficacy and reduces systemic toxicity. Moving on to our next topic, stimuli-responsive drug delivery. Stimuli-responsive drug delivery systems are designed to release drugs in response to specific stimuli found in the tumor microenvironment. For example, pH-responsive nanoparticles can release drugs in response to the acidic conditions typically found in tumors. Temperature-responsive nanoparticles can release drugs when exposed to mild hyperthermia, a technique used to locally heat tumor tissues. By utilizing stimuli-responsive drug delivery systems, the therapeutic agents can be released precisely at the tumor site, increasing treatment effectiveness and minimizing side effects. Let's now explore multifunctional nanocarriers. Multifunctional nanocarriers combine multiple functions into a single nanoparticle, allowing for enhanced therapeutic outcomes. These nanocarriers can simultaneously carry drugs, imaging agents, and targeting moieties. For instance, a multifunctional nanocarrier for breast cancer treatment could carry an anti-cancer drug, a contrast agent for imaging, and a targeting ligand that can recognize and bind to cancer cells. This approach enables imaging-guided drug delivery and personalized medicine. Our next topic focuses on thermotherapy and hyperthermia with nanoparticles. Thermotherapy involves using heat to treat cancer cells. Hyperthermia, a technique used in thermotherapy, involves raising the temperature of tumor tissues to damage cancer cells. Nanoparticles can be used to selectively deliver heat to the tumor site, either by absorbing external energy sources such as laser or magnetic fields, or by generating heat through exposure to near-infrared light. This localized heating can destroy cancer cells while minimizing damage to healthy surrounding tissues. Let's now move on to photothermal therapy using plasmonic nanoparticles. Photothermal therapy utilizes plasmonic nanoparticles to convert light energy into heat, effectively killing cancer cells. Plasmonic nanoparticles, such as gold nanoparticles, have unique optical properties that enable them to absorb specific wavelengths of light. When exposed to light, these nanoparticles generate heat and cause localized hyperthermia, leading to tumor cell death. Furthermore, plasmonic nanoparticles can be surface functionalized with targeting molecules to specifically deliver the therapy to cancer cells, increasing treatment precision. Our next topic focuses on magnetic resonance imaging, MRI, contrast agents. MRI contrast agents based on nanoparticles have revolutionized breast cancer imaging. These nanoparticles, typically made of metals or metal oxides, can enhance the contrast in MRI scans, providing detailed information about the tumor's size, location, and morphology. By improving the sensitivity and specificity of MRI, these contrast agents aid in accurate diagnosis and monitoring of breast cancer. Now, let's discuss nanosensors for early breast cancer detection. Nanosensors are nanoscale devices that can detect specific biological markers associated with breast cancer. These sensors utilize various principles, such as optical, electrical, or magnetic, to detect and quantify these biomarkers. Nanosensors offer improved sensitivity and specificity compared to traditional detection methods, enabling early detection of breast cancer and potentially reducing mortality rates. Our next topic involves microfluidic devices for liquid biopsies. Liquid biopsies have emerged as powerful tools for the non-invasive diagnosis and monitoring of breast cancer. Microfluidic devices play a crucial role in liquid biopsies by allowing the isolation and analysis of circulating tumor cells, CTCs, and cell-free tumor DNA from a patient's blood sample. These devices enable early detection of cancer recurrence, assessment of treatment response, and monitoring of minimal residual disease. Now, let's delve into nanobiosensors for circulating tumor cells, CTCs. Nanobiosensors provide a highly sensitive and specific platform for the detection and analysis of CTCs. These nanoscale devices can capture CTCs from the bloodstream, enabling their characterization and enumeration. Furthermore, nanobiosensors can detect specific biomarkers expressed by CTCs, providing valuable insights into the cancer's molecular profile and aiding in personalized treatment decisions. Our next topic focuses on nanoparticle-enhanced radiotherapy. Nanoparticle-enhanced radiotherapy involves the use of nanoparticles to enhance the effectiveness of radiation therapy in breast cancer treatment. These nanoparticles can increase the local radiation dose to the tumor site, leading to improved tumor control. Additionally, nanoparticles can enhance the radiosensitivity of cancer cells, making them more susceptible to radiation-induced cell death. This approach holds great promise in improving the therapeutic outcomes and reducing the side effects of radiotherapy. Moving on to our next topic, nanoparticles for gene therapy in breast cancer. Gene therapy has emerged as a promising approach for the treatment of breast cancer. Nanoparticles can serve as efficient carriers for therapeutic genes, protecting them from degradation and facilitating their delivery to cancer cells. These nanoparticles can be engineered to specifically target cancer cells and release the therapeutic genes inside, leading to the inhibition of tumor growth or enhancement of the immune response against cancer cells. Finally, let's explore the exciting field of 3D bioprinting of breast cancer tissue models. 3D bioprinting enables the fabrication of biomimetic breast cancer tissue models for drug testing and personalized medicine. Using bioinks composed of cancer cells and supporting materials, researchers can recreate the complex architecture and microenvironment of breast tumors. These models allow for the study of tumor behavior, drug response, and the development of personalized treatment strategies. Now that we have covered a wide array of topics in medical nanotechnology for breast cancer, it is important to summarize our findings. Medical nanotechnology offers tremendous potential in revolutionizing breast cancer treatment and diagnostics. The applications discussed in this script, including targeted nanotherapies, stimuli-responsive drug delivery, multifunctional nanocarriers, thermotherapy, photothermal therapy, MRI contrast agents, nanosensors, microfluidic devices, nanobiosensors, nanoparticle-enhanced radiotherapy, gene therapy, and 3D bioprinting, highlight the diversity and versatility of nanotechnology in combating breast cancer. With ongoing advancements in this field, it is hoped that these technologies will lead to improved outcomes, enhanced patient care, and ultimately, a brighter future in the fight against breast cancer.